Hi there, folks. Jason Kenney here in Edmonton at the legislature, and I'm going to be taking your questions for the next hour or so about Alberta's response to COVID-19. Any other issues you want to raise, but I suspect people may want to ask about the measures that we announced yesterday. Let me just quick update. Obviously, we are concerned about the spike in new cases and, most importantly, hospitalizations of COVID-19. I'll back up a step and say Albertans deserve really great credit for how they've done over the most of the past 9 months. We're all sick and tired of this thing. God knows I am. And it is frustrating. It's wearing on everybody's patience. And, of course, most tragically, it's cost lives as well as livelihoods. From the very beginning, we've tried to take a common sense, data-driven, balanced approach that, as I say, focuses both on protecting lives and livelihoods, recognizing that we need to manage or control the spread of this virus so that we don't end up with so many hospitalizations that it ends up really affecting our healthcare system. What we really cannot have is so many COVID patients that we have to start mass cancellation of surgeries and other non-urgent care. And so that is why it's necessary for us to try to manage and control the spread of the virus, and at the same time recognizing that for every restriction, damage is done to people's lives as well. Damage is done if we let the healthcare system get overwhelmed, not only by COVID patients, but by people whose surgeries and healthcare are delayed. And for every restriction, there is damage in the economy, to workers, to business owners, to people who end up unemployed, and all of the downstream consequences that come from that. Mental and emotional health challenges, the addictions challenge. We've lost more lives this year to opioid overdoses, for example, than to COVID-19. And many of those opioid overdoses, we believe, were the result of COVID response, when the government restricted access to residential drug treatment in the spring, and when the federal CERB benefit increased income for people who unfortunately are trapped in addiction, who spend their first and last dollar on feeding the addiction. So we have to measure all of these things, and there's no perfect way of doing it. I know there's a lot of critics out there. It seems like everybody these days is an amateur epidemiologist, and that's fine. Everybody has a right to offer an opinion. But I would just say, if you want to be critical of the approach Alberta's taken, that's fine. But please be constructively critical and tell us how you think we should better balance these many difficult and competing considerations. So with that, I'm just going to go straight to your questions. I've got one from Tanny Falls or Fallis. What are your thoughts on the reset? I think Tanny is referring to the Great Reset. It's actually a book I got in the mail. Was mailed to me by Klaus Schwab, who is the founder and president of the World Economic Forum, otherwise known as Davos. And I think he mass mailed these books to government leaders around the world, called The Great Reset. And I haven't read the book. I frankly have no intention of doing so. Best I can tell, what it's about is a concept that's been circulated by a lot of what I would call, well, in technical terms, kind of neoliberal people who believe that we should use the COVID crisis to radically remake society. And I guess, I saw a clip from Prime Minister Trudeau, which comes from, I gather, a speech he gave to the UN General Assembly, I believe in September, in which he was talking about remaking the structure of the distribution of wealth and environmental policies. I think it's a pretty vague idea at this point. What I find offensive is the notion that anyone would seek to, in a sense, exploit this terrible tragedy and crisis to advance their own political agenda in any way, shape, or form. We shouldn't see this as an opportunity, as some have said, to remake the world in our own, according to our own political vision or values. What we should do is focus on lives and livelihoods and getting through this and coming out stronger on the other end. And I must say this, I am, as I've said in my news conference yesterday, I am disturbed that in all of the COVID debate, there seems to be almost no discussion about the impact on fundamental rights and freedoms. For a country whose political discourse is often quite obsessively focused on charter rights and so forth, suddenly the gross and widespread violation of fundamental constitutionally protected rights and freedoms seems to have gone almost without debate. And that concerns me. Now, don't get me wrong here. I do believe that we must manage to keep down the spread of the virus, because there is obviously a compelling public health imperative here to prevent, to protect our healthcare system and prevent it from being overwhelmed. And that is important. And there may have to be, what I would hope, limited impairment of fundamental rights and freedoms. The Charter of Rights and Freedoms, our Canadian document, says that, and I'm going to paraphrase here, but that it enumerates a series of fundamental rights and freedoms. And it says that these, effectively, it says that these can only be abridged if reasonably justified in a free and democratic, by ways that are reasonably justified in a free and democratic society. And the courts have said, if there is such an impairment, it must be a minimal impairment of rights. So I'm honestly surprised to hear some folks who clamor on and on about rights suddenly demanding that our government impair rights as not a last and limited approach, but as a first approach to pandemic response. We have to balance all of these things off. But one of the reasons Alberta has taken has placed greater emphasis on personal and collective responsibility and the responsible exercise of freedom is precisely because we believe that any impairment of rights and freedoms should be minimal. It should be a last and limited resort. Sorry, that was a long answer. I'll try to be tighter in the next ones. Jonathan Guinta says, any new update on COVID-19 vaccines? Yes, Jonathan, thank you. That is one much needed bright light. There have now been 3 major vaccine programs that have been validated through trials, and most recently the Oxford University trial. My understanding is that they have all tested out in the trials as being at least 90% effective with no significant negative side effects. So that's a very positive sign. Obviously, they're going to continue with their trials. In the meantime, with those initial findings, all 3 of those manufacturers and consortia, one of which is Pfizer, they're going now towards large-scale production and then distribution in December. At least 2 of the 3, I'm not sure about the Oxford one, but 2 of the 3 require 2 vaccines, so it is a bit of a process. And the Pfizer one requires cold storage at minus 80 degrees Celsius, which is obviously is very challenging from a logistics and distribution perspective. Now, the Government of Canada, acting on behalf of the provinces because of its purchasing power and its scale, has a vaccine procurement policy or strategy, and we are told that they use that to purchase large quantities of vaccines from different prospective producers that they would then distribute across the country. They would withhold 20% of the vaccines to deal with surge capacity in some areas and distribute the other 80% on a per capita basis, meaning Alberta would get about 12%. And unfortunately, I did hear yesterday that the Prime Minister has said Canada is not at the top of the queue despite our purchasing power. Apparently that is in part because we do not have any manufacturing facilities here in Canada. The manufacturing facilities are in the United States, Mexico, and elsewhere. I think Israel has some manufacturing capacity, European countries. So apparently those countries, for reasons I don't understand, have perhaps their own domestic laws. They're basically requiring preferential access. They're going to be getting the vaccine first. So I think we're going to start seeing vaccination start in the United States by the first or second week of December. My understanding is we hope to begin receiving large quantities of these vaccines in January, and we are told to believe that we should be able to inoculate about 10% of our Alberta population by the end of the first quarter of 2021. That's the end of next March. We have received advice from medical and scientific experts on the parameters for vaccine distribution in Alberta. We have not yet made final decisions. I'll be making an announcement about this in the next few days, but I think the first cohorts of people who likely would have access would be medical workers and folks who work in nursing homes, and then the elderly frail, particularly those who live in congregate care, like long-term care facilities, who of course are the most vulnerable. And then we would build out from there to, the next cohort that is most vulnerable, perhaps the elderly who don't have multiple chronic conditions or live in nursing homes, and then we would go out from there to the general population. As you know, this disease has it is 1,000 times more lethal for people over 75 than people under the age of 30, for example. So there's a huge age correlation in the effect of the disease. In fact, Professor John Ioannidis, who is a Stanford University epidemiologist, has estimated in a paper for the World Health Organization that the inferred global infection fatality ratio for COVID-19, that is to say the percentage or the share of people infected who actually end up dying from it, he has estimated is, I believe, 0.27% for the overall population, and it is for people under 75, it's 0.05%, and for people under the age of 40, it's basically zero. It's statistically insignificant. I'll just add this. I found it very unfortunate that there were so many people here in Alberta trying to fearmonger and create panic around the reopening of the schools in the autumn, when the evidence has always been clear that COVID is basically virtually a non-statistical threat to healthy young people, and that the younger you are, even the less chances of transmission you have. Sorry, I went on a bit of a tangent there as well. I'll go to Linda Powell now, who says, how do you manage a grandparent providing childcare needs? Thanks, Linda. I think it depends on the situation. We are now at, we understand if grandma or grandpa is normally there providing childcare in the daytime, or you're dropping a child off with your grandparents, that is permissible within the rules. We're saying no social gatherings. That's obviously not socializing. And to be clear, your child is not at any risk, any statistically significant risk, should they become infected. And quite frankly, if they're with grandma or grandpa, that chance is much lower than being in a larger child care daycare setting. But I would just say it depends on the health of the grandparent, I suppose. If your child is just at home and then at their grandparents, they're probably just about as good as it can get. But if your grandparent is very frail and has multiple chronic conditions, I'm not a doctor, but I know that Dr. Hinshaw, if she was here, would say to be quite careful about that situation. Brad McGee says, do you have a plan on handling the NDP and their fear-mongering campaign? Brad, we're just trying to focus on our responsibility to the public, which is to protect lives and livelihoods on a database with policy that's driven by data, to take targeted measures that will be most effective while minimizing the broader impact on our social and economic health. And those are our parameters, not the hysterics and the fear-mongering of the opposition. I think it's regrettable from day one that here in Alberta we've had, I think, the only opposition party in Canada that has consistently sought to politicize every aspect of the pandemic. I believe in a vibrant democratic debate, and the government can and should face criticism. I would hope in this context, constructive criticism rather than just angry rhetorical criticism. But criticism is part of our system. That's fair ball. I just wish there would be more of a cooperative spirit and less divisiveness in the debate here in Alberta. James Fletcher says, when is the government going to take pay cuts? Well, James, some of us have. I took a 10% pay cut as Premier voluntarily last summer of 2019. And all MLAs and ministers took a 5% pay cut. That's on top of earlier pay cuts of 5% for all MLAs and ministers that were under the Prentice government. So my job is paid 15% less, MLAs, ministers 10% less. We are just at the opening stages of collective bargaining with the broader government unions that represent most folks who work for the Alberta taxpayer. And because of legal constraints around the collective bargaining, I can't say too much about it except that we will be asking folks who do work in the public sector to participate in at least some modest restraint given the collapse in our economy and the crash in private sector incomes. I believe the average private sector family's after-tax income is down by about 10% over the past 5 years. And this year, right now our economy, I think, is about, it's about 13, 14 points smaller than it was in 2014. So we saw about a 10-point shrinkage in the Alberta economy between 2015 and 2019. And then we saw a further 10% contraction in the first few months of COVID. Now, we've regained some of that ground in the last few months, but the bottom line is this: our economy is substantially smaller than it was. We have 300,000 unemployed people. Private sector people are earning significantly less on the whole. And people in the government sector whose work we value, especially right now, those in our healthcare system, but they have benefited from very strong job security, defined benefit government pensions, benefits that are generally much more generous than those available in the private sector. And now that we have a $21 billion deficit and we're in our fifth, going on 6th year of a weak economy, it is necessary for, if we are all in this together, then everyone, including those who work for the taxpayer, I think have to show shared sacrifice. That's what we tried to do, for example, in my position. All right, next question is, why are the bars and casinos still open? Tracy McLeod Hallahan. Thanks, Tracy. You know, first of all, I think you could ask that about anything. We have to draw the lines around certain parameters. We have, unfortunately for some, nightclubs have been suspended since the pandemic began in March because the nature of those venues, loud music, dancing, very close socializing, obviously that is a high chance of transmission. But we've been treating bars, pubs, and restaurants as one category, as it were, and we have very closely followed that with the data. We reopened those businesses for dining in service back in June with very clear public health guidelines that the overwhelming majority of those businesses have carefully observed. You know, for example, maximum seating of a group of 6, dividers at bars, no dancing, and lots of other rules. As a result of all of that, we had very robust contract tracing from June through till pretty much the end of October. It's now challenged because of the spike in new infections. But under all of that data, what we observed was that there were 18 identifiable COVID outbreaks in the 13,000 restaurants, bars, and pubs across Alberta. 18, so that was, I think, 99.8%, I believe, of of bars, restaurants, and pubs did not have traceable outbreaks. Furthermore, we were only able to trace about 1% of COVID case transmission back to bars, pubs, and restaurants. They employ collectively about 175,000 people. Surveys conducted by Restaurants Canada and the Federation for Independent Business have indicated that as many as 40% of those hospitality businesses may not be able to reopen if there's a second closure. So could you imagine in that scenario, 40% of 13,000, we're talking something like 6,000 businesses that are at jeopardy of never reopening, employing, I'm estimating, about 80,000 people. Many of they're disproportionately women, by the way. For a sector that is responsible, according to our data up till now, for about 1% of transmission. This does not meet our threshold for balance between lives and livelihoods. And moreover, we've now put additional restriction, whether it's bar, restaurant, or pub, which is that they can only, dining in service is limited now to a household cohort. So, because there's a ban now on indoor socializing, what we're saying is a family eats at home, they can eat out as well. In fact, statistically, far less chance of spread eating in a structured environment than at home. We've also, by the way, I think you know, have put in place a 10 p.m. last call for alcohol service and an 11 p.m. closure hour, because unfortunately we've recently seen a number of bars and some restaurants kind of turn into nightclubs, clear out the tables, crank up the tunes, and turn into basic de facto nightclubs, which are high chance of transmission. You asked also about casinos, Tracy. We do not have a single identified case of transmission in Alberta casinos since they reopened in the summer. Not one. There might have been, but none of them have been confirmed or traced. Zero outbreaks. They reopened with very rigorous rules and guidelines. For example, there's plexiglass dividers between all the slot machines. We have closed the table games, and we've limited occupancy now to 25% of fire code. So if there were no confirmed cases of transmission in the past several months, now that we've reduced capacity from 100% to 25%, plus all of the other measures. I mean, people wearing a mask seated 10 feet away from each other with multiple plexiglass barriers, the chance of transmission is at best negligible, I should say at worst negligible. And yet these casinos employ thousands of people, many of them minimum wage workers, and for whom that's their only check. And also many of these casinos are on First Nations who pleaded with us to keep them open because they are the major source of revenue for social services on First Nations. So again, when you look at all of that and do a cost benefit, what we basically decided to do, that entertainment venues generally, like movie theaters, well, gyms are not entertainment, but places like gyms, as well as casinos and retail businesses, we put a 25% occupancy limit to ensure a lot of physical distancing. All right, while still allowing them at least to pay some of the bills during this period, rather than putting tens of thousands of people out of work. Catherine Filipowski said, when will our children be allowed back in their dance studios and sports? Catherine, to be blunt, I don't know. We took the very difficult decision 13 days ago to suspend classes for sports and things like dance instruction. We know, let me just be clear, like we're not doing these things out of any desire or nor are we doing it out of ignorance about the huge physical and mental health benefits of things like dance classes and sports, which are a key part of kids' lives. But we had seen a significant and growing number of cases of transmission in areas like youth amateur sports. In fact, just in the past 2 weeks, Dr. Hinshaw told us, our cabinet, that there had been, I think, 9 outbreaks in hockey games. So these are potential vectors of transmission where you have aerobic, heavy breathing, aerobic activity, people who can be in close quarters. Here's the bottom line. With the direction of current cases, we have to manage down the spread somehow. And aerobic group activities are, frankly, at the top of every list from public health experts. We followed that advice, and I just hope. Listen, I'll answer the question this way, Catherine. If everybody follows the new rules we announced yesterday and our general guidelines, we would see a significant decline in the rate of transmission. That would be evident about 2 to 3 weeks from now, before Christmas. And then we could begin to reopen some of these activities. But right now, we're just not there. Pardon me, folks. I'm sorry. I have to pause every now and then. Rick Holman says, do you feel the federal government will enforce federal COVID restrictions further than what was put in place yesterday? No, Rick, I sure hope not, but the federal government doesn't have the legal or constitutional authority to come in here and impose their own measures. In the spring, the Prime Minister kind of mused about bringing in the Federal Emergency Measures Act, but he said that he had no intention of stepping in over top of provincial management of the pandemic. And there is zero support from that from the other provincial or territorial governments. I don't think that is a live issue, at this point at least. So Risa Kotchuk said, are kids definitely returning to in-person learning in January? Yes, Risa. The announcement yesterday was that as of this upcoming Monday, we will be having high school kids from 7 to grade 12. Let me rephrase that, from grade 7, not age 7, but grade 7 to grade 12, we'll go back to online instruction, and that the K to 6 kids will continue in-class instruction until the Christmas holidays, and then we are extending the Christmas holidays to January the 11th to have a kind of cooling off period after kids have been around family at Christmas time, because they may be infectious at that point. Now, let me explain why we made this decision. First of all, contrary to the panic mongers out there, the schools, teachers, parents, principals, and students have done very well. The vast majority of schools have not been significantly affected by COVID. As I said before, the health risk to healthy young kids is negligible, and as you go younger, less and less chances of transmission. Having said that, for teenagers, they can have levels of transmission about as high as those of adults, and so as that we've seen community spread generally across society, as Dr. Hinshaw's always said, we would see that reflected in the schools. We've seen it reflected in high schools, meaning more and more classrooms, kids, teachers, and staff have had to go into self-isolation, and enough staff are now in isolation, even if they're not COVID positive, pardon me, that it's becoming increasingly difficult to provide a quality educational offering in class in the high school. So that's one of the reasons we decided to do this. Plus, this is one way we could get hundreds of thousands of people back home in one fell swoop without negatively affecting the economy. I gather them, pardon me, there may be some parents who are not quite sure about letting their 12, 13-year-old, grade 7, at home in the daytime, but I think the vast majority of parents are going to be kosher with that, and so hopefully this will have minimal impact as well on the labor market. All right, 1 second. Debbie Babich says, why not make masks mandatory across the province? It seems ridiculous to not do it, at least for a while, until things calm down just a bit. Thanks, Debbie. Good question. So municipalities representing about 90% of the population have already brought in various kinds of mask mandates based on their own local conditions. We respect their authority to do so. Yesterday, we did bring in workplace mask mandate for the Calgary and Edmonton health zones, and that's where 83% of our cases are. There are large swaths of the province in rural Alberta where there is no significant case spread. In fact, we have about 100 hospitals in Alberta. 2/3 of them do not have a single COVID case, and those would tend to be in the more remote areas in rural hospitals. And let me just answer your question this way. Imagine you got a couple of guys working in a big barn way up in the MD of opportunity, hundreds of kilometers away from the closest COVID hot zone. Do you really think those guys are going to put on a mask because I asked them to or tell them to? Do you think the RCMP is going to go out there and write a ticket if they're not? I think we need to be, a little realistic about all of this. And I really don't think it makes any sense to suddenly turn tens of thousands of people into lawbreakers simply because, for example, they're not inclined to wear a mask on their farm or similar workplaces in remote areas. So I think we just continue to encourage mask wearing in crowded areas where people cannot physically distance, in workplaces where it makes sense, particularly in areas of high transmission, but that we not create a condition where there's a backlash, where people suddenly, a rural MLA in the legislature told me the other day that he's noticed that in his local IGA, people wearing masks, the percentage has gone up increasingly over the past few weeks to about 50% now. It wasn't like that at all in the summer. But he said, a lot of these folks who are doing that now, they'd take it off the moment the government tells them to wear it. So why would we do something that becomes counterproductive? So I just think we need to exercise just a bit of common sense in this. Leaf Aitken says, how is it okay for people to go to Costco or Walmart, but they are not allowed to shop at local businesses where less people already go? Well, Leaf, it's not okay, and that's why we were very clear in yesterday's guidelines and rules. Pardon me. Don't worry, it's not the virus. Just something went down the wrong way. So, Leaf, yesterday we were very clear in our guidelines that there is a capacity limit for all stores at 25% of fire code capacity, all retail stores, small, medium, and large businesses, but there's a floor of 5, which helps the micro small businesses. They can have up to 5 customers in there. They have to follow the guidelines. Staff should be wearing masks, sanitizer at the door, so physical distancing with the customers, all of that jazz. Because, Leaf, as I said in my news conference yesterday, I realized we screwed up this past spring. I'll just be blunt with you guys. We were in a rush. We were falling over ourselves a little bit, rushing in late March. We were afraid that a Madrid-Milan total meltdown was headed our way, and we needed to act very quickly. And so when we suspended retail businesses, we came up with this, quite frankly, I think, stupid designation of essential and non-essential. Let me say this. Every business is essential for the person, the family that owns it and the people who work there. And we never should have come up with that distinction. What we were trying to get at was, on the retail side, if you're selling things like groceries and pharmaceutical drugs, obviously they had to stay open. But then you get to the big box stores, the Walmarts and the Costcos and some others, and they were able to stay open because they do sell those things, but they sell everything else. And so we ended up with these small businesses with specialty products and services shut down, while all of their trade went to the box stores, and most of which are owned by big American corporations. We are not going to do that again, Leaf. We are not going to do that again. And I know we've got the NDP over here demanding we shut everything down, including all of these stores. We're a 25% limit. People very careful in those stores, wearing a mask, sanitizer, distancing. If people do this, here's my pitch. Please go and patronize those small businesses. In some cases, with a 25% limit, it might mean there's a bit of a queue outside. And I know some people might prefer just to sit at home and order on Amazon. please, instead of enriching Jeff Bezos, who's rich enough already through COVID, do a little bit, maybe if it's a little bit inconvenient, find a small business in your neighborhood, in your town, go and support them for Christmas gifts and whatever else. We need all together to try to undo some of the, at least in small ways, the damage that's been done to these small businesses who are the unsung heroes in our economy and are barely hanging on. Thank you for your concern for them, Leave. All right, Kim Duguay says, what are we going to be able to do for the holidays coming up? Are we going to be able to spend time with our families? Well, yes, Kim. Families, households, obviously, are able to spend time with each other. But in terms of visitors, right now we don't know. It is my desperate hope that we will be able to relax the rules on indoor social gatherings at Christmas time. But that's up to all of us. It's up to everyone. If people were simply to follow the one rule that we laid out yesterday around no indoor social activities, well, let me just back up and say this. If people were to, if people who are feeling sick or who have tested COVID positive were to self-isolate, that's the most important thing. Stay at home if they're feeling sick and stop socializing. If just those three things alone, we would see a dramatic change in the numbers before Christmas, and then I believe we could relax indoor social gathering limits for the Christmas break proper. If a lot of people just ignore this, and the spike continues, and the hospitalization numbers continue to pile up, then no, I regret we might not be able to do that. But we're going to take a look at the data on and around December 15th, and then a little bit later to make a final decision. Here's my personal advice. I think in this context, I would not be planning for big Christmas gatherings for 25 people over at your house. I think we're all going to have to try to scale it back. Honey Pell says, why is the the federal COVID app still not available in Alberta? Well, I understand that people can download it here, but at least I've been told that by people who've done so. The answer, honey, is the federal government has told us that they will only integrate it with Alberta if Alberta turns off our Trace Together app, which is far more effective from a contact tracing point of view. Let me walk you through this. Alberta was the first jurisdiction in Canada to come up with its own contact tracing app, and it is linked into our contact tracing system, by which I mean if through this Bluetooth interactivity, the app detects that you have been within 2 meters of a COVID positive person for 15 minutes or more, it advises our contact tracing system. And that allows the contact tracing system to determine whether this is an issue of concern and how it should be treated. The federal app doesn't do anything like that. It just lets you know that at some point in the last 2 weeks, you may have been in the vicinity of somebody who's tested positive. So even if you're asymptomatic, it basically kind of prompts you to go for a test, even if a test is not properly indicated. It's very important. We have tried to refocus our testing program on people who are symptomatic in priority populations to speed up the turnaround time. And we don't want thousands of folks who are completely asymptomatic getting back into the COVID testing queue, because that will that will lengthen turnaround times on the tests, which will slow down our whole response. Now, our view on this is the same as that of the NDP government in British Columbia. This is not a political issue. This is not about Alberta versus Ottawa. This is about what is the most effective public health practice. Alberta and BC are agreed. The federal app is, in some respects, counterproductive by driving up more asymptomatic testing. And here in Alberta, we have a better alternative that's linked into our contact tracing, which is Alberta Trace Together. All right, Joe Metallo says, how can you enforce the number of people in a home I pay for in my taxes, not to mention it is a charter issue? What portion of the law gives any politician the authority to do that? So, Joe, how can we enforce it? This is an authority under the Public Health Act, in a public health emergency, the Chief Medical Officer of Health can issue orders, public health orders, to limit the spread of a pandemic. The actual language in the legislation is a pandemic influenza. This is not technically an influenza, although it has similar characteristics. And the answer is that under the, you may have heard me speak earlier about the importance of respecting charter rights. I believe I'm the only political leader in the country, at least that I've heard, who has been raising that as what should be a limitation in our COVID response, while others are wishing that we violate the charter indiscriminately. I am saying that any impairment of the charter to keep our society safe, to save lives, must be a last and limited measure. It must be, in the language of the courts, it must be a minimal impairment of those rights. Let me say, I do believe this is a justifiable and minimal impairment in a free and democratic society, given that by far the single largest place of transmission and activity which leads to viral transmission is the is at-home transmission, particularly through socializing. So 40% of our traceable cases have come from private social activity, much of it at home. 40%. Now, you know, it is important that we've gone through all of this without taking those measures, and now we're in this spike. If the spike continues, Joe, here's the reality. More and more COVID patients end up in our hospitals, in ICU beds, and okay, that's our responsibility. The healthcare system has to treat those folks, and we have a lot of capacity, and we can open up more capacity. All good. But as we open up that capacity, it comes at a price. We're getting to a point where every additional bed that we have to open up for a COVID-19 patient is a bed we're taking away from someone else. And in many cases, it's a surgery that we are postponing indefinitely. That even includes, in some cases, things like cardiac and cancer surgeries that have been scheduled. And all kinds of non-urgent medical care that gets canceled or postponed. That then obviously has negative health effects for those people. Not to mention the mental and the emotional anxiety, the stress, the depression, the pain, the suffering, in some cases potentially reliance on opioids, which can lead to addiction. It leads to a shorter lifespan for those people, a shorter life expectancy. This weekend I spoke to, I called up, I think about 15, 16 doctors and nurses who are either acquaintances of mine or friends of friends, just to hear how it's going on the front lines. And generally, the reports are hospital healthcare coping very well with COVID. We do have a couple of hospitals, one in Edmonton, one in Calgary, under a lot of stress with COVID, but generally speaking, they're doing well. But they're all concerned about the downstream impact for other patients. So, Joe, yeah, if you want to say, hey, it's my freedom to hold a big party, it's a free society, I'm going to hold a big party. All we're asking, Joe, is people responsibly exercise freedom, and in this case, inconvenience themselves for a little while. If you have a loved one who's waiting for surgery or has ever had somebody who's needed surgery or ever had to go to a hospital, just think about them. So, as I said yesterday, like I never ran for public service in order to tell folks who could or couldn't go and visit them at home. The whole thing is the whole idea is at one level just unbelievable. I can't believe I'm in this situation. But we honestly believe at this point we do not have an option lest we end up with mass cancellation of surgeries and hospital health care. And we just think that this is a targeted thing. It's, you know, by the way, the Charter of Rights doesn't say there's a fundamental freedom to have a party. I mean, it's implicit in terms of mobility and obviously, even though the Charter doesn't talk about property rights, which I think is a shortcoming, it's implicit in our whole legal structure. So I get what you're saying, Joe, but can we stop? Like, let's think, just how about we be considerate for those folks whose lives are going to be put in misery as their healthcare gets canceled because of COVID viral spread. That's just all we're saying. Chris Sloan says, will you be offering provincial funds for struggling businesses? Chris, we already have the Small Business Relaunch Grant that's gone out to, I think, 60,000 small and medium businesses. And our Minister for Jobs and the Economy, Doug Schweitzer, just relaunched that with more flexible criteria. And people can apply for it a second time now if they need that support. Plus, we are partners with the Government of Canada on the Commercial Rent Assistance Program and a number of other things, and we'll see. But at the end of the day, like, there's just there's no way we have the fiscal means to replace all of the income that businesses have lost over the past 9 months, unfortunately. Kathleen Hicks, hello Connie, says, my 10-year-old son Taylor has a question. Hello Taylor. He's asking, once a vaccine has been approved and is ready to be administered, how long will it take for our world to be as it was pre-COVID? Hey, Taylor, you know what? That is not just a very good question. That's the best question we've had tonight. And Taylor, that was a much better question than any one I got in the legislature today in question period. So good on you. The answer, Taylor, is we hope, knock on wood, that we will be able to go back to normal by next summer. By the end of this coming March, around Easter time, we hope and believe that the most vulnerable people will have been vaccinated, and that will be a total game changer, and we can really start opening things back up at that point, and then I think we can be, please God, back to normal when there's been wider vaccination by next summer. Claire Day says, are ski clubs allowed to stay open? Really small groups and the kids are outside? Yes, Claire, they are. And that's, in fact, folks, one good thing you can do for your own health and to help struggling tourism businesses and operators is to go to our ski hills this winter. They desperately need it. They're COVID rule compliant, limits to the number of people that go on the gondolas and things like that. But there is very little risk of transmission out on a ski hill. Outdoors, healthy, people are distanced, and yes, they're also wearing ski masks. Peter and Andrew Verhoog say, why did you just call a state of emergency? Thank you, Peter and Andre. The answer is because with the spike in cases, which we expect to continue for at least some time, more and more people will be going into the hospitals, and at some point we are going to have a real challenge in managing our hospital workforce. About 6% of the workforce is on sick leave, either because they are COVID symptomatic or tested positive or they're a close contact. And that has some of our hospitals under stress with respect to workforce. And we may need to use the legislative tools under the Public Health Act through the declaration of an emergency to manage our workforce in the hospitals. That's the main reason. All right, Elena Murphy says, I live in Lethbridge for school, but my family is in Calgary. Am I just not allowed to go home and spend Christmas with my family? Well, right now, Elena, as we are today, the rule is very clear. No socializing indoors, apart from your own group in your household, the people who sleep there every night. If you're single, you're allowed to have 2 close contacts. So if you're single, I think going and seeing your parents would conform to the current rules. But we're going to give everybody an update, Elena, before Christmas on where we're at. So just hold tight on that. Right now, we'll know better, I think, on December the 15th, when we've had a chance to see whether these new measures have had any impact on the spread of the virus. Crystal Johansson asks, when will rural Albertans have better access to testing? Well, Crystal, yeah, I mean, that applies, I think, everywhere. We're constantly trying to get our testing numbers up. We've done very well. We've had the highest per capita number of tests across Canada and much of the world for most of the past 9 months on and off. And we do acknowledge that it can be a little slower and perhaps a little more challenging to get access in rural. So I will raise that with the health department, and because frankly, I just don't know. I mean, I've been told repeatedly that we have a pretty good testing platform available through rural hospitals and health clinics and some pharmacies, but let me look into that, and I'm sorry I don't have a better answer for you right now. Michael Gabriel asks, why is there a limit of 6 for households and restaurants? I feel this is unfair for larger families. Fair point, Michael. Yeah, it's just that we have to draw the line at something, and we had the 6-person limit in restaurants. Here's my suggestion. If you've got a 10-person family, go get 2 tables, and they can be in the same part of the restaurant, and hopefully that's a way to work around it fairly and safely. Jackie Stratton says, how do you explain Sweden's numbers with no lockdowns or masks? Jackie, that's a bit of a misconception. Sweden has, it's fair to say Sweden's not had a lockdown. Neither has Alberta had a lockdown. But Sweden has had restrictions, just as Alberta has had restrictions. In fact, our restrictions have been, in many ways, quite similar. All this year, right from March until now, Sweden had a limit of 50 people on gatherings. In fact, I think they just reduced it 2 weeks ago. I'm not quite sure of the current number. It's something like 10 or 12. And so Sweden has had a limit on those numbers. Sweden shut down nightclubs like we did. They created limitations on bar and restaurant service like we did. They actually suspended the high schools in the spring, like we've just done for the next couple of weeks, and a number of other restrictions. We were actually, in some respects, less stringent than Sweden. I know you're not going to read that in some corners of the angry pages on Facebook, but the fact is, in Alberta, until yesterday, we had no numerical limit, for example, on how many people could gather at worship places of worship. We did have a requirement for physical distancing, but in Sweden, no more than 50 people could go even into the largest church, for example. So in some respects, we have been less stringent than Sweden. But it's not true that they have not had spread. In fact, they have a death rate. I haven't checked this for a little while, but their death rate was 10 times higher than Alberta's per capita. Not a price that I'm willing to pay. And secondly, their new cases and hospitalizations are going up as sharply as they are anywhere in North America. So you might want to Google, if you don't completely believe what I'm saying here, you might want to Google Sweden new COVID restrictions, and you will see that they have imposed a number of restrictions quite similar to what we have done as well. And look, don't get me wrong. I'm not trash talking the so-called Swedish experiment. It's been very interesting, and until recently, with the exception of some really bad outbreaks in nursing homes in March and April, and they clearly did a bad job of protecting the vulnerable. But apart from those outbreaks, they have done, I'll grant you this, they've done very well with a light touch on restrictions from May through till recently, through basically to mid-October. They've done quite well with low death rates, fairly low hospitalization rates in that period. And that's very interesting. It's been a very fascinating object lesson of different public health response. But now, there was a lot of commentary on the Swedish model, that they were supposedly driving for so-called herd immunity, meaning, of course, a critical mass of the public getting infected, recovering, therefore being immune for a period of time. In fact, the epidemiologist who's been the chief medical officer for Sweden, Mr. Tellberg, has said that they were never shooting for so-called herd immunity. And in any event, as Dr. Hinshaw, you said, it's not even a viable strategy for us here in Alberta, because our inferred total infection rate, based on our sero studies, our serological testing, is right now probably a little over 1, certainly under 2% of the population. So 98% of Albertans, based on our best estimates, testing and data, have not contracted COVID. So to so-called herd immunity or community immunity means, there's different estimates. Some say 25%, others say 60%, but we are so far from that. And if we were to drive towards community or herd immunity, there would be a huge increase in the death toll and an overwhelming of the healthcare system. So I understand, like, as you can see, I've followed the Swedish kind of debate very closely. They've had some successes, some interesting lessons to be learned, but it is by no means a model for others to follow. Each of us are trying to find our own best way through this. Jafar Musa says, if cases continue to increase, what does the government plan to limit the spread? Thank you, Jafar. So we are going to carefully monitor the impact of the regulations, the restrictions that we just imposed yesterday. Although, Jafar, they will not show up, the results will not be clear for at least 10 days. Let me give you a prediction. What you're going to see in the next 10 days is continued high numbers of new cases. I'm anticipating typically over 1,000 a day. We've been bouncing around a positivity rate of 8%, which is to say the percentage of tests that come back positive. And so that likely will not go down for at least the next 2 weeks. If we see no progress, and by the way, we infer from the positivity rate and other data inputs what's called the RT, which is the rate of transmission. We believe the rate of transmission in the province right now is in the range of, I believe, about 1.25. It's at about 1.1 in Calgary, about 1.3 something in Edmonton. That's the rate of transmission. So what we're watching for, Jafar, is based on all of our data, including our positivity rate, we want to see if that R, that rate of transmission, comes down below 1. It's not good enough to get it to 1, which means that we're still seeing dynamic growth. We have to get it below 1, ideally to 0.8%, to have some confidence that we can potentially relax some measures. But, Jafar, if we see that the RT, the rate of transmission, and the positivity rate stay constant or increase from where we are now, on December 15th, we will then have to have some really, really tough decisions about even further restrictions that God forbid, but that is a possibility. Because if we just let uncontrolled spread continue, I'll come back to it, that shows up in the hospitals, and that then leads to widespread cancellation of surgeries and other medical care. All right, one moment, please, just one sec. All right, Sherry Thompson asks, as a pub owner, hello, Sherry, we're a bit confused about how we are to police the tables. Are we supposed to know that people live together to live or live alone? Are we supposed to start asking people for IDs? The answer is no, Sherry. It's not your responsibility to enforce that. That's been our view all along. And it was when we gave a guideline in the spring about, in the summer, in June, when we reopened pubs and bars and restaurants for eat-in service, our guideline was that it should be for cohort groups. And Dr. Hinshaw was clear that there's no expectation that restaurant staff or managers are going to enforce who's in the group. Obviously there's a degree of trust we're having that people are going to limit to their household group. All right, I've been at this for an hour. I'm going to take just a couple more questions because I am supposed to get over to the Legislative Assembly. So David Krupp says, Jason, I'm a full supporter, but where is the hard stance against Ottawa in support of oil and gas? Okay, different subject. That's nice to see. It's been a year, and Justin Trudeau is still walking all over us. Now he has an easy ally with Biden. Thank you, David, it's nice to have a subject change. Well, the hard stance is there, David. We are at the Supreme Court suing the federal government over their carbon tax. We won at the Alberta Appeal Court. It's gone to the Supreme Court of Canada. We rounded up a whole bunch of provincial allies. I think there's 5 other provinces with our back there. And the Alberta Appeal Court will soon hear oral arguments on our constitutional challenge of the federal No More Pipelines Bill C-69. We are also backing a constitutional challenge of the tanker ban Bill C-48 through First Nations who are pro-resource development. We, as you know, made a strategic investment in Keystone XL to hedge the risk of the federal government not getting TMX done. And we're making progress on TMX, I have to say. One of the reasons we are having a referendum on equalization a year from now and not this fall was to have some leverage, something to hold out there as pressure, as leverage for the federal government to continue progress on TMX. The BC government has said that they've downed tools in opposition to TMX, and they continue to issue permits for that. But let me just say that while we are defending ourselves in all of those and many other ways, we also, frankly, need to work with the federal government to get some of these things done. I mean, they own TMX at Trans Mountain. And so we have to be smart about moving forward on that one. We appreciate that the federal government has said they've made get completion of Keystone XL and avoiding a presidential veto of the permit Canada's number one bilateral issue with the future Biden administration. Very important to us. We managed to get a regulatory equivalency agreement on proposed federal methane regulations. Basically, that means that they've allowed Alberta to regulate that space, something that the oil and gas industry desperately wanted, which has prevented billions of dollars of additional job-killing costs for the industry, because now Alberta will apply our regulatory approach in a much more common sense way that limits costs and impact on jobs. Similarly, we got an equivalency agreement with them on our levy on major carbon emitters, the Technology Innovations and Emission Reduction Plan. Again, the oil and gas industry will tell you that equivalency agreement will save the industry billions and billions of dollars. We did get $1 billion out of the feds for the Accelerated Well Reclamation Program, which is putting good blue-collar oil field service people to work right now. So the way I would say it is there are some issues where there's just full-on unapologetic defense of our rights and our interests, and on other issues, trying to find a practical way to mitigate the damage of federal policies or to advance our economic interests. All right, Norm Jewell says, please address people's concerns in regards to whether COVID vaccinations will be mandatory. No, Norm, COVID vaccinations will not be mandatory, not in Alberta. In fact, our government will be amending the Public Health Act early next year when the legislature comes back. We'll be making a number of amendments to the Public Health Act, one of which will be to remove the power for the government to impose mandatory vaccination. That power has been in the Public Health Act since, I think, 1910. I don't believe it's ever been used. So let me be absolutely clear. Alberta will not be making that or any other vaccine mandatory. We're not going to strap people down to force them to be injected with the vaccine. I think the very idea is ridiculous. We will encourage people to use it because the more people who use it, the better off we're all going to be. Obviously, we will only participate in the distribution of a scientifically validated vaccine and one that is ethically produced, but we will not be making that mandatory. Last question, because I've got to get to the ledge, is from Marlo Hofer. I will say thank you for not locking us down completely. Thank you, Marlo. Yeah, this is not a lockdown. Others want us to do that. There may have to be more restrictions if we don't bend this curve down to protect people's health care. But we are trying to do this as best in a balanced way. These are strong measures. I don't like any of them, but they are, in our judgment, necessary. They are targeted. They are limited. And I'll close with this. And I know there's many more questions I wasn't able to get to. just thank you, folks, for your patience and forbearance. We're all tired of this, but if we give it a real serious effort over the next 2-3 weeks, if we stop social interactions, no indoor social gatherings, work at home if we can, especially stay at home if we're sick or feeling sick, if we just do those basic things and follow the other guidelines, the numbers will come down, and we'll be able to have more of a normal Christmas, God willing. But at the end of the day, we will do what is necessary to protect people's lives. So thank you very much, and God bless.